Hey everyone, and welcome to Holding the Line with Got Your Six Counseling. I'm Peggy, and this is Brittany. This is a space where we get real about the shit nobody wants to talk about: mental health, life, trauma, healing, and everything in between. Sometimes we get clinical, sometimes we get messy, but it's always honest. Quick reminder, this podcast isn't therapy, and it's not a substitute for professional care. We're not here to provide therapy, diagnose, or treat. If you're struggling with mental health, please reach out to a licensed provider. You don't have to go through it alone. We've got your six. We're just two trauma therapists showing up as humans first, ready to have real, unfiltered conversations about the stuff that matters. We're here to break the stigma, share what we've learned from both sides of the therapy room, and talk about the challenges people face every day, especially in the veteran and first responder communities. Whether it's trauma, burnout, relationships, identity, or just getting through the week, we believe that these conversations matter. They deserve space, and that's what we're holding the line for. So let's dive in.
Back, everyone. This is our third episode with Holding the Line with Got Your Six Counseling. And today we're going to be talking about what is therapy really? What is therapy, how it works, and what do we as therapists do, especially tailored to those who might be skeptical and unfamiliar with the therapy process, or if you're hesitant about seeking help. We're your hosts, Peggy and Brittany. Well, I'm Brittany. She's Peggy. And we're going to be talking about what is therapy really, and do you really need it? And is it just talking? Like people say all the time, I'd love to have your job. And all you do is just sit in a chair and talk to people all the time. What do you have to say to that, Peggy? What's your rebuttal?
I mean, yeah, do we get to just sit in an office all day and in the comfortable AC? Yeah, but it's so much more than that, because like we have to sit with people. And what is really sitting with someone?
Sitting in
You
that
know,
space and holding it.
yeah, because like it's uncomfortable. It's uncomfortable for everyone in the room. When someone is just sitting there and spilling their guts, whether it is, hey, I'm just having a bad week, to I've had this very massive experience and I don't know what to do with it. And I don't know where to place those feelings. Or it's this little kid that has all the big emotions and they are a little big ball of all the feels and they're just rampaging through your sand tray.
My sand tray, and they're spilling sand everywhere, even though they know that the number one rule of the sand tray is to keep the sand in the tray. They're not regulated enough to do that. And kids are the hardest ones, I think, because they don't want to talk. They don't do talk therapy until that one day they come in and drop that bomb on you, and they say something very outlandish, and you're like, and then you have to sit there and hold that, and it's not an easy job to do, right? We're not just shooting the shit, It's not just. I mean, I'm sure there are days where you're shooting the shit, right? But those are few and far between. Most days you're processing some really deep stuff, and you're sitting with them in that moment. They're sharing the story with you about these things that happened. And I don't know about you, but we're kind of sitting in that space with them. You're reliving that experience with them. And that's not easy to do. You go home after a day of 6, 7 people. And I'm like, I don't want to speak to another person. I don't have the spoons for that, So it's, I love it, but some days it's harder than others, and especially with the people that we work with, it can get heavy, and I love to make it uncomfortable. I love to make it uncomfortable. I see
Yeah,
it's my
all the
Roman
people
Empire,
avoiding.
right?
Yeah,
Yeah,
yeah. Can I make you cry today? Absolutely.
I told
But
one of my newer patients today that I love to make them cry.
but that conversation of like, what is therapy in like the most common terms? Like, is it a conversation? Yeah, it's absolutely a conversation, but it's also whatever you need to make of that time and that space. And what do you need therapy to be?
Right, a healing process, right? it's a journey through healing. I think for that's what you would like it to be, but I think it's different for everybody.
Yeah, because I think so many times now we have stereotyped therapy into looking like what it looks like on TV. And like it has to be like the therapist has to sit across from you and they have to like, hold the notepad and they have to say all these awkward questions or they just sit at you and go, and how does that make you feel? Oh my
Tell me about
goodness,
your
no.
mom.
See, your mom.
Your mom, literally, because of your shirt. I love that. I think that there's that misconception of like, we're going to blame it on your parents. I can't tell you how many people have said that, like, I don't want to go to therapy because I don't want to like blame everything on my parents. And I'm like, I mean, sure, but psychodynamically speaking, we're going to go back in time and talk about those experiences, but that's not everything, right? That's not everything.
Yeah,
But there are
like,
different types of therapy, right? So
yes.
depends on
And
what you need.
it's and not everything is like one size fits all. We get lots that have come from different modalities or have never tried something for the first time. And it's like, hey, I'm going to make you really uncomfortable. Let's try this thing called parts, which is internal family system. And they're like, what do you mean, parts? I'm like, we're made up of all of these different things, our feelings, our emotions, and like these internal parts of us. And I'm going to make you talk to them. And they're like, that sounds weird. No thanks.
I
It's
don't
like,
have
no.
multiple personalities.
I'm like, that's not what that is. But I was like, let's have a good conversation inside of ourselves. And they're like, that sounds weird, but I'll try it. Cool.
Other people are like, I don't want to do that. This is weird. This is uncomfortable. And I can't access those things. And I'm like, okay, well, moving on. It doesn't work for everybody, right?
Or EMDR. The first time that I was even doing EMDR on myself, like when we were doing EMDR on ourselves with training, I was like, what is this voodoo? What is this witchcraft? That's weird. That is uncomfortable. And I don't know if I want to sit in on that again.
I love
Just the
EMDR so
uncomfortable.
much. Yes.
Yes, just like the uncomfortableness, but it was so wonderful because I was like, well, that was quick processing. I do it again.
I
Or
hate you.
Josh
Do it again.
watching, yeah, like Josh watching me come out of training, bawling my eyes out, going, I'm okay. This is for the betterment of my patients. And he's like, are you sure you're good? Are you okay? Nope, not even a little bit. Because it was really being there and going through the memory and like getting to that touchstone, which is that childhood memory where like it attached to all of that feelings and that worth and everything, and like how it transformed those memories going forward and being able to process it then and tone down that feeling. And I was like, oh, now it feels better. I like that.
I think there's a lot of misinformation, a lot of misconceptions about EMDR as a whole, right? Like I see, comments on social media. They're like EMDR messed me up, and EMDR is terrible and it's intense. And I will not deny that EMDR can be intense for some, but I think if you choose the right therapist who is, competent, keyword, and who knows what they're doing, EMDR can very much be a transformative experience for those. I had EMDR personally in therapy, and then when we went through the EMDR training, that is not an easy process. Like to learn it and to do it well, right? And then the training itself was rough. So I can say from a personal perspective of like, I've done this myself and now I'm doing it to you. So I know it's not easy. I've done it twice, right? Like I did it personally and then I've done it in training. And then it is hard. Like if you lean into it and you really do it, it's not easy, but the end result is like, so I'm going to say rewarding, but it is, right? Because you're putting that stuff behind you. I always give the analogy of like, you're looking through binoculars and that's very, like it's very close up, like your trauma, your triggers. And then when you flip it around and it's so far away, like it's never going to go away completely. We can't take it from you, but it can be less triggering and less upsetting. Like it's less emotional. So like give it a try. and just go into it with an open mind and just lean into it. It can be intense, but just give it a shot. Like if you have someone who's good at it, we've all been trained pretty well. So,
And then like seeing some of the new things coming or newer to us, like I am very intrigued by brain spotting and how that works. I know you had that even done on yourself. Like see, I want to learn
admittedly, I'm
these
avoiding
things.
it a little bit. I'm avoiding it a little bit every week. She's like, let's try it. And I'm like, I think we'll try it next week. So I haven't actually done brain spotting yet, but she keeps pitching it to me. So we're getting there. That's my own avoidance. Hi. But brain spotting does sound very interesting. None of us do it yet. But brain spotting is another one.
CBT.
CBT is the old hat. Um, you know, CBT works well for a lot of things. Doesn't work well for trauma, but works well for a lot of issues. Group therapy is hit or miss. Some people really love it, and some people really hate it, and that's okay. I like doing group therapy, right?
But it's
I like,
but it's a requirement with all of our students.
yeah, it
And
is. I had to do it.
I find it interesting what the students create when it's
Hmm.
time to make a group.
It is because everybody has their own ideas and perspectives, and then their own population that they want to do group therapy with. Like I did mine with children, which was so much fun because like kids are fun in a group setting. Um, they're wild, and I destroyed the group room with what activity I tried to do. We got cornstarch everywhere. Sorry, Christina. I don't know if she still doesn't know about that. I was still cleaning up cornstarch the next day because there was a black curtain and there was white cornstarch and handprints all over it. And Sophia was, anyways. So like you learn, you live and you learn. But group therapy is fun. But I feel like sometimes, like especially with our veterans, they're like group therapy is awful. But I think if you're the right um, person in charge of it, it can be also very, very good and transformative. I've used that word a lot tonight, haven't I? Transformative. It's a good word. It's a good word. Talk therapy is, that's kind of like what we do sometimes, but I guess that's what we do. Is what we do talk therapy?
Oh yeah.
Yeah, I
But
guess we do a lot of talk therapy.
do you tend to have like this more structured approach, or do you
Yeah.
just kind of go at it and like what we do is what we do?
Yeah, I'm kind of just like, hey, how are you? How was your week? Right? I kind of like the first 10 minutes is very much like, I'm wondering how things are going. Right. And then I might delve into whatever we talked about last week, or I don't really give homework. I'm not a homework therapist, depending on the person, unless they're a teenager. I don't really do homework, unless they need more structure. But like, I think CBT is very structured, right? DBT is very structured. We're giving homework and things like that. I don't do that unless it calls for it, right? But I'm not very structured in that way. I'm going to give an intervention. I'm going to teach things, but I definitely have what I would refer to as a hard-on for psychoeducation. Um, all of my patients know that. I'm like, hey, did you know? And they're like, I love these conversations. I had literally had someone tell me that today. She's like, I love these conversations because no one's ever told me this. And I'm like, how? How have you not ever learned this? But I think, and I can't speak for them all, but I think some therapists just don't. They don't ever decide to like teach their patients these things. And I don't understand that.
And I think that's a big important part of the conversation, especially at the beginning, like when we're starting it with, why is my brain working the way it's working? Well,
Mhm.
like what does PTSD involve? What does depression involve? How does it affect my brain? Why is it affecting my brain this way? How does medication affect it?
Right.
If I introduce positive stimulus, how is it going to affect it? What is dopamine? What is serotonin? What are all of these things? I think telling them about those things is so important.
Right. And like, especially, the ones that have significant trauma, and like when you're introducing EMDR, it's like, this is how trauma affects your brain, and this is fight or flight. And they're like, wow, I didn't know that. So I think understanding the what and the why is really important for people because this is a different type of therapy that we're providing. We're not working with the walking well here. Like I think, when Christine explained that in the first episode, we're not working with these type of people. And I think it's very validating for them to understand what they're going through and how they got here. And so it makes it a lot easier for them to engage and trust us because, it does. It makes it easier, I think.
Or
Um,
not using these overly clinically words with our people too, because like nobody's gonna know what an amygdala is until like you
right,
show them, hey, this is where it's at in your head and this is what it's responsible for.
right. And I'm not just handing them a trauma workbook and going, let's work on that. Have I used a trauma workbook before? Yes. Right. When the situation's appropriate, I've done that, but I'm not just handing it to them and be like, let's work on this. Right. Um, I'm not having them draw pictures of flowers. That's not the kind of therapists we are. Or pulling out a binder that says how to treat trauma. True story, right? Um, they're not just venting, they're not just complaining. Like, this is like real evidence based work in science. It's real, right? So, you know,
I mean,
um,
are you allowed to vent? Are you allowed to complain? Absolutely.
mhm, because it feels
But
good to
that,
do that.
yeah, and you need to. And it's part of the processing because, hey, it happens in your day, it happens in the past, it happens in the present, in the future, like all of those things. You need to get that out because holding back on it just makes it worse.
I think that's kind of why I always say, like, hey, how was your week? How are you? And they kind of get that first like 10 minutes of just like, bleh, right? Like, they kind of like word vomit to me. And then I'm like, well, how are things with this or how are things with that? Because that kind of leads into like the issues that they've been having or the things that we've been working on. Because if you don't give them that space to like word vomit that stuff out, then we don't really get to do the real work because they think, oh, I'm going to see a therapist. I got to talk about my stuff. If you don't give them that space to just spit it out, then you're never going to really get to the good stuff.
Yeah, and that's where like the rapport part is especially important. So they get comfortable in telling you about the hurt, the bad things, the good things, even celebrating the successes of like, hey, I did this really great thing and it was so scary. I love
Mhm.
celebrating as
Yep.
much as I love hearing about the bad things.
Even if it's something that seems as silly as like being able to go to the movies, because how many veterans do we know that can't go to the movie theaters? Right? Like, oh my gosh, I went to the movies with my spouse or my daughter or whatever, right? And I'm like, that's such a win because the movies is such a scary place for them because even if they do go, they can't enjoy it because they're I don't want to say paranoid, that's probably the wrong word. They're too hyper vigilant to even enjoy the movie. So like that's a huge win. And I want to say regular people wouldn't be able to understand that where you and I are like, that's huge. It's huge. Or sitting in a restaurant space without, clocking exits and actually being able to enjoy a meal. So, you know, I
And
think that's
so, and then where this differs from like just me talking to you, like on the regular, talking to your friend.
no, that is
How's
therapy.
therapy different? But that's like the some of the another misconception out there. How can I just talk to my friend? Yeah, I could talk to you every day, and I do. Um, but I my therapist is there for those things that I just it is I can't get it out. I have trouble processing or I am ruminating on it and I don't know why I keep circling back to it and like why does the hurt linger?
Right.
Because like our friends are great at telling us, well, just stop letting it bug you, or they don't understand how to like tell you let it go, or how that hurt is still affecting you from childhood, or like 30 years later, like your mom.
I think number one, we're non-judgmental, right? We don't
Exactly.
judge, like, if our walls could talk, right? Like, we're non-judgmental about the things you're coming to us about, and we're unbiased, right? Like I don't know my patients' families, right? Where, like, if you and I are talking, I know your husband, I know your kids, I know your family members, and you know mine. Where, I only know what you're telling me. So we're non-judgmental and we're unbiased. And I think having that neutral party is like number one, right? And also we have the knowledge of, attachment and all the other like evidence-based things that are important to know to help them sort through the issues that they have. Um, those are really two big important things I think that solidify that for me. Also, um, I just lost my train of thought.
Catch it.
Yes, please come back. You go on with your things while I'm trying to bring that back to me because I had like several good points and then like it just completely left my mind. It's a Wednesday night, words are hard. Oh my gosh. Um Man, what was I gonna say? Whew.
I love it.
This is the real, raw, unfiltered we were talking about, like
Absolutely. And then like the reason because like we're talking to people that are coming in for trauma, depression, anxiety, life transitions even. So like all of these things that are can feel so nebulous, so extreme. And just with the dealing with those like how do we keep holding that space in those types of things, because like these are just some of the common reasons. But when it's less than that, because like there's no one reason to seek therapy.
yeah, for sure.
you know,
It
I
came
think
back.
this is where what came back to you?
What I
Cat,
was
you
gonna
caught it?
say. It came back.
Okay.
What I was gonna say is, I think a lot of times when you're talking to friends,
Hmm.
they want to offer like these ridiculous solutions, and not that they're not valid or good, but like when I'm talking to a friend, I just want them to hear me out, and they're giving me all
Well, they
these
want to.
ridiculous. Yeah, they want to give me all these ridiculous solutions and this advice. That's really not probably good
That's the thing.
advice,
It's advice, and it's
right?
not like it's not tools. It's
Right.
not skills,
And we don't
and
give advice,
it's yeah. I think
right?
those are the differences. It's advice, and like advice is not always a good thing, or they want to fix it.
Hmm.
Like, and that's even like some of the issues with spouses. Like, they're not just listening; they want to fix it, and like that's a great thing that your spouse wants to like help you and fix it. But like sometimes just shut up and listen.
Right. Right. So it's not like I don't need a solution. I don't need to be fixed. I just want you to hear me, right? Like I just want to word
Yep.
vomit this out to you as my friend or my spouse or my mom or whoever and just be done with it, right? Because I just need to feel heard and move on. Where when I go to my therapist on Fridays, I just want her to tell me and challenge me through my avoidance and the stuff that I'm doing to move forward, right? Because she's the one that has the skills and the tools to do that, right? And like, I challenge the crap out of my patients all the time, and they're like, ew. And I'm like, I know, it sucks, right? And they're like, I don't like you very much. And I'm like, it's okay. It's all right. You don't have to like me, but you just keep coming back. So something keeps bringing you here, you know? Um, so I think that's the other thing, right? Like, as a friend, if I challenge you, you might be like, ew, Brittany, like, why are you being mean to me, right? And you're like, oh, Brittany doesn't sugarcoat anything. And I think that's another attribute of a good therapist, right? We're not sugarcoating it, we're challenging you. Again, on the Roman Empire of like making you cry. We push you to feel emotions, right? Like, we want you to feel it. Our
Yep.
population doesn't know how to feel that.
Oh no, mine is the Roman Empire for me is when they're like, I don't like you. See you next week, or fuck you. I'm done.
Yeah. I hear that a lot when we're doing EMDR. I like you very much. I'm like, good,
Yeah,
keep going. Notice
because
that.
they're absolutely. I mean, it's hilarious because they're like, I'm like, I already know you like me. Bye. I'll see you next week.
Right. At the end, like when you're bringing them back down, you're stabilizing, I'm like, do you still not like me? And they're like, it's okay. I'm fine now. Sorry about that. I was mad in the moment. I'm like, yeah, no, it's okay.
But that's why they're in therapy because all of these things that they're coming in for, like I was discussing earlier, and like if we treated people like how we treat people with physical health conditions, like we don't treat people with mental health the same way.
No.
Like we're not telling somebody with a wheelchair to like get over it. But why are we treating people with mental health this way?
Right. No, I mean, and there's that stigma of like, maybe we're getting ahead of ourselves. I'm not sure, but there's that whole like, especially for those with like hardcore religious backgrounds of like, oh, well, you can just, and not that you can't do this, right? That you can go speak to your pastor or you can seek this kind of help or that kind of help, and that's fine. But you can also do both. You can definitely do both
Because
because
mental health is health.
Because if you had high blood
Though
pressure, you had diabetes, or you had asthma or cancer, you would seek treatment for that. So if you have trauma or depression or anxiety or OCD or whatever, it's okay to do that too. Because you want somebody who's competent and specialized in treating those things. And not everyone, I'm going to repeat this again, not everyone is competent in treating trauma. Do I need to say it
and it's
again?
okay. Yeah, and it's okay to try different therapists. I think that
Oh
is
my God, yes.
totally fine. It's okay to say I'm not your cup of tea.
Mhm.
That's fine. If
We're not
we're not good
offended.
together, we're not, yeah, we're not good together. I don't know how many times we've had people just be like, we're not a good fit. Don't just like no show and all of the things. Just say
Like,
we're not a
tell
good
us.
fit.
Because we would rather you have good rapport with someone than just leave and give up, right? Because, like, A, we're not all created equal, right? B, rapport, which means trust, is like the foundation of our relationship. If you feel like you can't trust us or you're not connecting or driving with us, please tell us because we will help you find someone that we think you or you think you can connect with. We, you, however, because we want you to have that. Like we would rather you be in therapy with someone than no one. Um, we'll help you find someone. I mean, I can't tell you the amount of people that like will come and see me and you for the first session and they never come back and we're like, just tell us. Email, phone, text, the Google Voice, carrier pigeon, anything to let us know that like you just felt like you didn't jive with us and you want to see someone else. We will help you find someone else. We're not offended at all.
I don't know. I'm offended when they no show.
I'm only offended when they leave us for a life coach. That happened to you, not me. Sorry,
I'm like, I'm
I just
so
kind of rubbed salt on the wound, huh? I guess we can
rude.
circle back to that later.
Later. But like, it feels like it's like, are you breaking up with me? But no. But
Yeah.
I'd rather, yeah, go find somebody that is the fit than no fit. Just because, look, I am weird. I'm eccentric. I'm conversational, and sometimes that is not. Look, I'm not going to be for everybody. You're not going to be for everybody.
Yeah, I'm not everybody's cup of tea, right? Like I can be I can be a lot confrontational, depending on like why you're coming in, right? I'm more confrontational with certain people than I am with others. I'm not confrontational with kids, a little less confrontational with teenagers, right? I can go from sitting on the floor and coloring with kids to sitting on my couch and playing some games with teenagers. And I mean, so like it just depends on the type of patient I have. I can wear a lot of different hats, you know?
I'm meaner to the students than I am to my patients.
Yeah. Yeah. I got to get back in the swing of things when Hillary comes back. You know, I feel like I've got a little out of practice. So sorry, Hillary. Off topic. You know, it's like she'll be back. I gotta start exercising for that because she'll be back in a couple of weeks. So I got like a little over a month to get back in the swing. But I mean, okay. Why do people need therapy? I think everybody should go to therapy. My dad jokes. He's like, Brittany, this was a direct quote if he sees this. Brittany thinks everybody should go to therapy. And I'm like, well, I mean,
Absolutely.
it's not
Everybody
going to
should.
hurt you. I mean, unless you get a shitty therapist, right? Like, I mean, I guess that could hurt you. But generally speaking, I don't see a reason why like therapy would hurt you for any reason.
Well, my husband would be really proud here because I'm going to use a car reference because, like, you bring your car in for oil changes and,
Maintenance.
like, it maintenance. So why wouldn't you maintain yourself?
Exactly. Yeah. In some cases, it could be considered self care, right?
Yeah. Because, like, even if you are the walking well, a check in every now and then to make sure you good is fine.
I
Doesn't mean you
had
have to do
years
it
of
weekly.
therapy. Years and years of therapy, went through some stuff, and like I went back to therapy, but I feel like there's always stuff you can dig up again, right? Like you can always like poke and find things. I can always find things, right? Like you think you're okay, not wrong. We can always find more things to dig up and find, you know?
Yeah, because some
So
people are great and they're like, hey, I just need to come in for that, like, my every 6 months. Cool, that's fine. You're checking in on yourself. You did the work already. You healed the wound. It's now a scar. And yeah, we're not trying to go over that over and over and over again.
yeah,
That's pointless and counterintuitive. Don't let somebody, rehash your scars.
for sure.
But yeah, maintain yourself. I think that is a fabulous way of doing it. Some people are like, well, I don't want to deal with my issues. Okay. Eventually, you may want to.
Maybe you should, but like you, I can't make you. So whenever you're ready, we're here, you know?
And that also, I think, brings up a good point to this. Like, the person that was made to go to
Mhm.
therapy, we can't force you to be in the room. And I think that's a lot of, like, teenagers or spouses that
Mandated.
were
Yeah.
like, yeah, you won't do the work if you're forced to be there.
Yeah, I think that's one of the challenges in working with adolescents, you know, because they come in and they're like, you know, as the therapist, you're across the room like, you know, because it's really, it's really hard to engage someone who doesn't want to be there with you. You know, it takes months to build their trust because they're just, you know, and for some of them, you're the same age as their parent. So they view you as very much like the same authority figure as their mom or their dad or whoever kind of forced them to come. So you are also an untrusted adult. So you kind of have to work in reverse. You're working against the tide there. Not the tide, the current. You're working against the current there. And it's rough, I'll tell you. So you're very much like, what kind of movies do you like to watch? And what's your favorite food? And you're kind of like trying to relate. And some teenagers are rough, you know? Um, Boys are easier than girls. Girls are like you know, like because most of them are act so much older than they really are. The boys are easy because they be like, "What kind of video games do you play?" And all I do is just rattle off whatever games Landon's playing, whatever gaming systems he's got, and they're like, "I can't believe you know that." But the girls are rough, and it just makes it even more satisfying when you get there, you know. But yeah, the ones that are made to go for sure. Um, but the people that are experiencing like life transitions, I think are I want to say a joy, but those are the kind of the ones that you kind of get like this like satisfaction out of, right? Like they're graduating high school, they're going to college, or they're, they just moved here and they're like, oh, I'm just struggling, like these adjustments, right? Because you just kind of see them like flourish and move on, like, like Haley. Haley loves those. She's like, oh, just move them
It must
through
be
it.
nice.
Yeah. But those are kind of like the walking well, and I need the chaos, right? Like I just thrive on it.
Yeah,
If someone comes in,
because
they're
the
kind of
life
doing well, I'm
no
like, get out.
the life transitions we get are chaotic because it's usually like retirement, military
Yeah.
retirement, and
Yep.
like the
I
the
don't know how
wall
to do
came.
this.
Yeah, no, the wall came down because like
Hmm.
they've been tucking away like PTSD and depression and anxiety and all the things, and like the wall finally came down, and I'm like,
Hmm.
oh, you got flooded, and they're like, what do you mean I got flooded? I'm like, you got flooded, buddy.
Yep. Yep. It's like
And they're
everything
like,
happens at once, right?
yeah, and they're like, well, put it back, and I'm like, yeah, that's not how this works.
It's too late now. All you can do is go through it together. It's like every week is something new, right? They're just like, I can't believe this is happening. And you're like, yeah, we're on this roller coaster together, bro. You never know what they're gonna come in with. That's what I live for. If
I
they
love
come
it.
in and they're like, I'm like, how are you? And they're like, everything is good. And I'm like, okay, bye. Gotta go. What do you mean everything's good? All right, well, I guess my job here is done.
I love that with teenagers, especially because I'm like, give me three good, three bad. I'm like, I'm gonna force this out of you one way or
Yep.
another.
And they're like, I don't know.
I don't know is not an answer. I mean,
I
it
guess
is,
I'm
but
I guess I'm happy, and that's how they talk. They're like, I guess I'm happy and I'm sad, and like, and you're just like, really?
or our favorite is sit there and stare back at them and see who blinks first.
Yeah. You got to get creative. You got to get creative. You
Because
know,
therapeutic silence is a thing, and the stare off begins.
there is a fine line between therapeutic silence and the staring game, right? It's like, okay. Also, like therapeutic Uno, right? That's another one, you know?
Yes.
Um,
No, how good is it to not let a child win or let a child win? Like, where are you on this board of like letting the child win?
No, we don't let anybody win in Uno, right? Like if you win, you win, and if you lose, you lose. You know what that teaches? Emotion regulation, and that you don't always win at life, right? Like we're teaching emotion regulation skills by playing Uno, and that is true. Okay, because if a child loses, you get to see their reaction, and then you get to teach an intervention on what it's like to lose and how to handle that. See, and learn something new every day. Sometimes if they're really young, you gotta live. I might not throw down a draw four on purpose because I'm like, God, if I've got a handful of draw fours, I'm like, this feels cruel. And I think that's the mom in me. I'm like, I can't do this to this child.
Especially one after another. I'm like,
Yeah, now if it's a teenager, I'm not holding anything back. I'm like, pow, pow, pow. But if it's like a 5 or 6 year old, I'm like, I can't do it. Now they don't care about doing that to me. They're like, um, but and that's like play therapy. But they love the slime, they love the clay, but they're not very nice to me about it. They're like, what are you making? That's ugly. And I'm like, focus on what you're making. All right. Just
um, I love their
that.
no filters.
Yeah. I'm like, let me worry about my flower. Okay. Like, just focus on your leprechaun. Okay. uh, but I love playing on the floor with them. So it's like there's play therapy. There's a time when that's needed. And, they're focusing on all sorts of things. Sometimes we're working through their anxiety or their trauma or maybe their life transition. Kids, kids don't really talk about stuff like that.
Yeah.
They work through
And
it and
then,
play.
and typically like our sessions are, intake, where it's fact gathering, it's getting all the information from them, like
Rapid
those
fire.
sessions. Yeah. And like it doesn't seem very warm and fuzzy the first session because we are gathering all the information at first. And like that's a lot of people. Like it while you want to build rapport in this first session, like it is about getting all the info from you. Like why are you here? What can we do? Like, what are the goals that we're gearing towards?
Right. And
And
then like giving our little spiel at the beginning too, right? Because I'm like, okay, this is me, and these are all the things that I have to go over with you first before I start rapid fire asking you questions. I'm
what
like,
happens
also,
in here?
right. I'm so glad I don't ever have to say that I'm a resident in counseling again. And then I jump into all that, right? And then we start
Yeah.
rapid fire asking questions because we're trying to formulate a diagnosis. We're trying to get all your history. We're trying to um, build this uh, background for you before we move into like the hard stuff with you.
Yeah, because those first few sessions are about like the rapport building, the gaining trust, the getting to know you
Getting to
aspect
know
of it.
us.
But yeah, so that way we can get into like the hot and heavy of it all.
Yeah.
And it's never about how can I fix you. It is about how can I help you? How can I guide you? What tools do you need? How do we get these emotions, you want your emotions regulated? Cool. Here's a tool to help with that. Here's some DBT skills. Here are skills to go along with all of these things that we're feeling.
Yeah. That's the other thing too. People come in with the misconception of like, my therapist is going to fix me, or like a parent comes in and they're like, fix my kid. But
Parents are the worst with that.
yeah, yeah. And like, it took you what, 15, 20, 30 years to get like this. We're not gonna fix you in a year or 6 months or 2 years, right? Like it takes time to like work through things. And like, we're seeing you once a week for 45 to 55 minutes, right? Like, we're giving you or helping you with like the skills and insights and tools and techniques. Like, you have to do the work on the outside in order for this to work too. So we're not fixing you. We're just helping you find this, giving you the tools you need to like do it. So we're not fixing you. We're not fixing your kids either. And the
What's the
progress, huh?
hmm?
Go ahead.
What? Oh, seeing the progress that
Hmm.
they make because it can go either way, right?
Yeah. I
It,
mean,
it,
sometimes it's forward and then they're making really good progress, and all of a sudden they're regressing. And that treatment plan is like goes from significant improvement right back down to some improvement, or you
trash,
know,
trash.
trash, or
This is
like
trash. I'm
if
trashed.
don't try not to internalize it, right? you know, right? Or someone you've been seeing for a year that's made super good progress is now standing in the corner of your office because they've relapsed into like major PTSD symptoms, like, and that's just the way it works, unfortunately, depending on what they're experiencing at home. Because like I said, once a week, 45 to 55 minutes, like, you're not with them the rest of the time that they're not with you, so you have no idea what they're experiencing, and that's life. That is real life.
it's
um
it's gonna ebb and flow. It's
mhm.
not gonna be like, hey, you're gonna have progress in the first 90 days, and so we don't become forky immediately and go, I'm trash.
Yes, we do. That's our job. We're the ones who feel like trash, not you. I call Peggy and go, I'm trash. I'm an imposter. No, for real. It happens. It happens. It's normal, right? Like, you start to feel really good and then you regress and then you pick yourself up and you keep going, right? Or maybe you don't make any progress for the first 6 months. That's fine too. You know, sometimes your avoidance wins over. and you're like, I'm not doing this. And then you finally find yourself, and you move forward. And it's not linear either. Like grief isn't linear. That's a very common catchphrase, right? Grief isn't linear. Healing isn't linear. That's another common catchphrase. I think I have a pillow that says that. That would probably make Christina throw up in her mouth. I have a pillow that says, healing isn't linear. But it's not. It doesn't happen in a straight line, right? Like there's no theme to it. You heal in different ways. Everybody heals differently.
That'd be like if you have one of them live, laugh, love.
I do not have a live, laugh, love. When I bought my house, somebody gave me a live, laugh, love like candle, and I was like, right the trash. Off topic, there's that guy on TikTok where he's like, live, laugh, love, and like his mom has them everywhere, and it just gets more and more aggressive. Absolutely not. You will not find that anywhere here or in my office.
But I mean, this is all kind of like destigmatizing the couch. Like, this isn't, none of this is stereotypical of like what we're seeing on TV, what we're seeing in the movies and stuff like that, because it's not like that. It's never going to be. I don't know how many times me and you sit there, yell at the TV, like, did you see this? Did you see how they were doing? Like, and no. Or the worst one is when they sleep with their patients.
I can't even watch therapy shows because I started watching one and I was like, wow, this is really cool. Like the patient kind of threw herself at the therapist and he rebuffed her. He was like, what you're experiencing is transference. And I was like, yes. I was so excited. And then like 6 episodes later, I was like, you disappoint me, sir. You disappoint me. How dare you? I was like, turn it off.
You were supposed to be the chosen one.
I was like, you failed me. I was so mad. I was like, I can't watch it, right? I guess that's like medical professionals who can't watch like medical shows or like firefighters. And, I mean, it's just not real life because real people like us are like, you can't do that. And also, why? So it's okay. We just can't see it.
Or they're mixing us up with like psychiatry or
psychologists, right?
Yeah,
like because everyone's the same in Hollywood, right? Like there's no delineation. Is that the word? Of like therapists, like counselors and social workers, or psychologists or psychiatrists. Like we're all just grouped in the same category. And like one of my patients today called me a psychiatrist. I was like, no. I'm not a psychiatrist. Those are doctors, like medical doctors. And he's like, oh, what are you? I was like, I'm a licensed professional counselor. And he's like, oh, what does that mean? I was like,
I can't write you meds.
I can't write you meds. And I don't have doctor in front of my name. But I can give you therapy. You're welcome. He's like, oh, well, that's good enough. I was like, thanks. I'm glad. I'll see you next week.
Yeah, I was like, would you like to go through the like hierarchy of things? So I was like, psychiatry writes the meds.
Yeah.
Do they do talk therapy? Sometimes.
Yeah, not so much anymore though. Yeah.
Yeah. I was like, psychology. They do the testing. And they have different
that's the only difference now, right? Like I had my first therapist was a psychologist and she gave me hardcore, like good therapy. But like, I guess there are some that want to do therapy and some that only want to do testing. And I don't like, yeah.
And it depends on the path that you go. Like Christina is doing neuropsych. Mm-hmm. So like, it really just depends on what type of psychologist you are, what type of psychiatrist you are, just like with us, with the LPCs and the social workers and the licensed clinical social workers. There's so many of us,
right?
But
we all have the different training. We all have different like, what am I trying to say? Like paths to get to where we are, right? I think we have another. Not trying to jump ahead, but I think we have another podcast where we talk about just that, right? Like the differences between. Is it between us or is it just between like
I
Psychologists
think
and psychiatrists.
no, it's between everybody and the
Yeah.
differences in like what everybody does. But like
Yes.
that's why I said that, like that it's again, it's just the stereotyping that's done in our profession and like who we are and what we do.
Yeah. So, like, if you had a really shitty experience, I challenge you to go find someone else. If you have trauma, find someone who is specializing in trauma, like one of us, right? Look for the CCTP, one or two, right? That means they have trauma training. They are certified trauma professionals, or they are what's the other? I don't want to say buzzword, but what's the other one? They have like competencies in trauma. It will say on their profile, either on Psychology Today or Therapy
Hmm.
Den or whatever, right on their website. They are competent in treating trauma. That's the kind of person you want treating you, not just some, I don't want to say regular therapist, but someone who's not competent in doing that because they're not going to know those things as well as us who have had specialized training in that. Or someone who does EMDR would also be a good fit. Um, and know that they're not there to fix you. They're just going to help you. They're just going to help you along, which is what we do. It's true, right? We don't fix people. We're not
Yeah.
doctors fixing broken bones, right? It's not that simple.
No. But like in therapy, but when you're speaking to it medically, like therapy is not a crutch too, though.
No, no, that's true.
Because like some people will hold on for so long that we do become like we're no longer a tool, we're enabling.
Yeah, it's true.
And so like we're there to be the tool, not to just I don't want to keep you like be a walking well and be healthy on your own.
Yeah. It's scary for a lot of them to like, especially ones we've had for a while, when you're like, I think we need to decrease. And they're like, no. And you're like, okay, calm down. It's
Feels like a bad breakup because you're like,
right.
I think we need space and we
It's
need to
not
see
me.
each
It's
other
not you. It's
less.
me. Right. Right. We got to see each other less.
Because
And they're like, oh my God.
yeah, they're like, that's gross. And I'm like, I know, but we're going to be okay apart. It's such an awkward conversation
It
because
really
I'm
is.
like, why does it feel like I'm breaking up with someone?
And you really anticipate their reaction. You're like, this could go really well, or this could be really bad, right? And then most of the time it ends up going, they're like, okay, yeah, like they feel good about it, but you're afraid that they're going to react. Some react more than others, but you kind of like slow it down in a slow fashion, like every 2 weeks, once a month. And then you're like, okay, I think we're good. And they're like, no, you're trying to get rid of me. I'm really not, but like also, you're doing well. It's okay. You can always reach back out. I'll always be here.
So really encouraging, like, to try it, not necessarily like, okay, you have to stay with it for the next 5 years or 3 years or 2 years or even a year. Just try something that's uncomfortable. And I think that is a huge thing there is embrace the uncomfortable. I know for like my husband and like their people would always say like embrace the suck. No, just embrace
Yep.
the uncomfortable.
Yep. And like, they what was that? Was it it's grad school really, where they're kind of like, you start planning discharge on the first session, right? Which really is not, I think for the walking well, you can do that, right? Because I've had
Hmm.
some walking well people where like 6 months, 8 months in, I'm talking about discharge, right? Because they're doing well, right? They're making really good progress. And I don't think you can do that with veterans. And you can't really do that with even first responders because of the extent of the things that they've been through. And you really don't know how long you're going to have them for
Hmm.
either. So you really can't plan discharge that way. And sometimes they'll just come in and they'll be like, yeah, today's my last session. And you're like, what? I'm sorry. Can you repeat that? So sometimes they impulsively are just like, yeah, I'm not coming back after today. And you're like, I don't think that's a
Excuse
good
me?
idea. Yeah, you're like, I think that's a good idea. So you just never know what's going to happen. And so you kind of just have to, I don't want to say you have to go with it, but also you never know and you can't plan. So sometimes you have them forever and sometimes they decide they're going to just leave. So you can't really do that. And just being supportive of their mindset, which is very, what did you say? Warrior like? Yeah.
Warrior.
It is.
That's what
it is.
Embrace the uncomfortable.
Right. Because they're like, this is weak for me to talk about this, or I don't know how to talk about my emotions, and you're just going to try to give me all these medicines. And I'm like, I don't give medicine. I can't give you any medicine, right? That's Sabine.
No, we're just going to talk about your feelings, and that's going to make you uncomfortable. Right.
Also, I'm not Peggy, so if you don't want to see Sabine, you don't have to, but you're just lucky you're not seeing Peggy, because she would force you to see Sabine.
I'll force nothing. I'm just like, you need some meds?
Right. The other one is like, well, I've tried this. I hear, I don't know about you, but I hear this a lot. I've tried all the things and they don't work for me. I've tried.
Cool, you haven't tried me.
Right. All right. I've tried all the breathing. I've tried all the grounding, the 5, 4, 3, 2, 1. I've tried all that. It doesn't work. And I'm like, I know. I know those things don't work for you because you're not like everybody else, right? Like, really? Okay. I have some other cool things. Let's try those. Right? Because those are like the standard things that regular therapists are going to give them to work, and they don't work for people like we see. They do work for some people, but they don't work for our people.
Yeah, but so how do they go about actually finding someone that is like us?
What do you mean? That's like us?
Like, how does someone find a trauma-informed therapist? How does somebody find somebody that, is CCTP or any of these things? Like, when somebody's out there looking for a therapist, is because I know we have Psychology Today, Therapy Den. What are some of the other places they're all scurrying to look for us?
Those are the two main ones. Is there a third one?
Unless they're VA, and then
I think there's like the Psychotherapy Network. There's that magazine. Yeah. They also have a website. I think you can there are people listed there, but there's not a ton of therapists listed on there. But so Psychology Today is the main one, right? Where you can go and look.
Yeah.
Psychology Today is like chef's kiss, because you can filter like your insurance, you can filter gender, you can filter if they're trauma informed or the specialties they work with, like if they're LGBTQIA like allied or whatever, right? Like you can do whatever you want at the top of the page.
That thing feels like Tinder for therapists.
Right. It literally is Tinder for therapists, right? And then at the very top, you can choose your location. Mm-hmm. Like if you're if you're Richmond, Virginia, or like Arlington or wherever, right? Like you can choose. And then when you scroll down, you can choose if you want, it'll say on the side, like telehealth and in person or whatever. And then you can click the little button that says contact me, email me, or call, right? Like you can do whatever. And so once you filtered it out, you read the little bio. And then at the very bottom, it shows like their insurances, if they're only self-pay, it shows everything.
Just don't psycho-dial from Psychology Today 10 times in a row, because it will not. Right. It doesn't go well.
And I always say, like, if somebody's looking for a therapist, so don't put all your eggs in one basket, unless you're emailing us, because you'll get a response, right? Some people are listed on Psychology Today, and you'll reach out, and there's no hate, and I'm not talking shit. Because people are busy. I get that. We're busy. Peggy and I are insanely busy. Like, she's the training director. She stays busy. I'm the clinic. I am so busy. I'm so busy, right? We have an endless to-do list. But somehow we still find time to reach out personally, at least we try, to the people that reach out to us on Psychology Today. And if I don't reach out to the people personally, our admin does. And same goes for Peggy. And we have intake coordinators that do the same thing. So, but there are people out there on Psychology Today who don't do that. And I have personal experience with that. I will call 6 or 7 people for myself or my kid, and nobody calls back. So I say that to say, do not put all your eggs in one basket. Reach out to at least 5 or 6 people. If you reach out to us, you will get a call back. But if you reach out to them and you don't, keep trying. Email or call them. Email might work better because you could say, hey, this is me. This is what I'm looking for. Here's my name and my phone number and my email address. Please call me back. Sometimes if you put in your insurance information, you get a call back faster because they want to know who they're going to bill. Therapy I don't have a ton of experience with. I'm listed there, but I've never actually used it. So I'm sure it's very similar to Psychology Today. So same thing. Reach out, give them your information, keep moving. Trauma informed if you need trauma informed. If you're looking for a life transition, that too. If you need medication management, it's the same thing. You can click psychiatrist, psychologist, testing, whatever you need. Filter it. Also, less effective, but you can still do your insurance. You call your insurance and say, I need a therapist. And they will give you people that they are network with. Because self-paying for therapy can get pricey.
Absolutely.
So we'll still take you. We'll still take you. But if you can't afford it, use your insurance. So yeah. That was it. We got the websites, the directories.
Mm-hmm.
Good books to read.
Absolutely.
Do you want to talk about some books? The Body Keeps the Score. Our Lord and Savior, Bessel van der Kolk.
No Bad Parts.
What's another good one?
Walking the Tiger. No Bad Parts.
You have. I saw you looking at your bookshelf. Peggy's got some wild, outlandish books on that bookshelf.
You leave my books alone. Because it depends on what you want. Trauma or sex.
She said trauma or sex. Like, well, there's that one that we're going to be talking about soon. If you want to go ahead and read it, it's called Defeating the Giant. Roseanne Nunnery. She was actually my grad school professor. It's about narcissistic abuse. You can find it on Amazon. It's not an easy read, but there's a lot of really good information there if you've ever been a victim of narcissistic abuse. Excellent read. Codependent No More is a good one if you are one of those people. I was actually feeling very seen reading that book. I was like, wow, I'm not codependent. And then I read it and I was like, oh god, maybe I am a little codependent. What's the other one? Oh, what's that one that we have it's I love you, or I hate you, don't leave me, or something like that. I hate you, don't leave me. Yeah, I hate you, don't leave me. That's the borderline. Yep, that's a good one. Of course, like, we're not diagnosing people here, but like, also, if you know, you know, wink. I'm not very good at winking, so sorry, y'all. If you know, you know. So yeah, some of those are really good books. Yeah, tune in for more. Is that all we have? I
think that is all that we have today.
We want to thank you for tuning into this episode of Holding the Line with Got Your Six, where we are just a bunch of therapists who talk about the shit nobody wants to talk about. We hope you got something useful out of it. Stay tuned for more of our upcoming episodes every other week posted to our YouTube channel, Holding the Line GYS. If you want to help support our podcast, please like this video and subscribe to our channel and share this video with others you think may get something useful out of it. Make sure to follow us on Facebook and Instagram, where we will post useful information, dark humor, and more of the shit nobody wants to talk about. Go forth and do magical shit, everyone.
Next week, we have buzzwords in therapy that are being overused.
Yeah, and I mean, like, sorry guys, eventually we'll have our I say, my sister, who is a 911 dispatcher, we've had some scheduling issues with her trying to get her in here. And I'm sorry, okay? Like, she's busy. She's out here doing work, helping save lives, okay? So, like, eventually we'll get her in here and get her perspective on things. So, like, just be patient, okay? Don't be mad at us. We're still giving you content. So, we'll get there when we get there, okay? So, buzzwords next time. Thank you for liking and sharing. We've got lots of new followers and lots of new subscribers just with our first 2 episodes. We love you guys. Thank you for tuning in and tune in for our next episode, and we'll see you on the next one.
Thank you so much.